Experts say the agreement that created Ballad Health is raising the standard for state supervision of COPAs. Others say it does not do enough to give patients a choice. News Channel 11's Jackie DeFusco brings you both sides from our nation's capital.
In Washington, D.C., officials are discussing the dangers of inadequate state oversight and a healthcare monopoly. At a Federal Trade Commission workshop, I asked how Ballad Health's COPA stacks up and what's at stake. If you ask advocates,
despite the motto, it's your story, and we're listening, Ballad Health is not listening.
Their position is clear.
We want to know answers, and they have not been very forthcoming with answers.
That state oversight of Ballad Health is insufficient.
It's just wrong to say that the public doesn't have a voice in this. They can complain to the state will investigate those complaints.
When it comes to certificates of public advantage, experts say active state supervision is critical.
What can go wrong is that they stop doing that. They stop doing the active supervision, and suddenly you've got a monopoly that's unobserved.
Stakeholders in other states where COPAs have come and gone told the crowd at a Federal Trade Commission workshop that the process was riddled with politics and complications.
The overall feeling is that COPAs are probably something that most of those states wish they would have avoided.
Ballad Health CEO says they learned from negative impacts following the repeal of COPA legislation in other states.
If the statute is ever changed or repealed, like they did in North Carolina, there's language in the COPA that says the terms of the COPA shall continue to apply.
For now, Tennessee and Virginia are charging forward with what some experts describe as the most thorough COPA ever created.
We take our responsibility for active supervision very seriously. A takeaway for me is that we've done a lot of good work, but we have a lot more work to do.
A Virginia regulator says the state is still building their active supervision framework. They're coming up with a format to investigate complaints locally. Plus,
we are working to finalize a memorandum of understanding with the Southwest Virginia Health Authority for them to serve as our local advisory council, to be our eyes and ears on the ground in Southwest Virginia, which is very important.
Regulators say they're making progress, narrowing population health metrics meant to track commitments that the FTC described as vague. Regulators say it's been a challenge to gather data and establish baselines.
In terms of the performance, what I can tell you right now is it's too soon to tell. We've only been in effect for 16 months.
Advocates and one member of Tennessee's local advisory council arguing the state shouldn't allow the merger to progress this summer.
The state should strongly consider holding off on that consolidation of assets. We heard from virtually everybody on the panel that this has been a very difficult process for Ballad.
They say Ballad should have to wait until the effects of the COPA are more clear.
Well, that's not true. There is clear and convincing evidence. The state found that there was clear and convincing evidence in approving the merger.
The Federal Trade Commission will be collecting public comment on your experiences with COPAs on their website until July 31st. In Washington, Jackie DeFusco, News Channel 11, in your corner.
If you missed any of Jackie's previous stories from Washington, we will have them all on our website. Just head to WJHL.com.